Greetings from the US. I wanted to once again touch on the recent conference dedicated to regenerative medicine. The event brought together leading experts to discuss innovative approaches and emerging regenerative therapies. One of the key topics was the critical role of vitamins and minerals, essential elements that support the body's optimal function and overall well-being. So let's talk about vitamins D and K. Vitamin D isn't even just a vitamin, it's a hormone. And most of us, especially those living in cities or working in offices, are not getting enough of it. For years, the recommended daily dose was only 600 to 800 IUs. But now we know many people need up to 10,000 IUs per day, and in some cases even more. So what does vitamin D3 do? It helps your intestines absorb calcium. It strengthens and mineralizes your bones, and it supports your immune system and even regulates cell growth. Your body makes it when your skin is exposed to sunlight. Just 20 to 30 minutes a day can give you a solid dose. But if you don't get enough sun, supplements are essential. Now, let's move to vitamin K2. This is the unsung hero of bone and heart health. Vitamin K2 activates special proteins like osteocalcin, which make sure the calcium you absorb actually goes to your bones, not your arteries. This helps prevent vascular calcification, which is a major risk factor for heart disease. So how much should you take? Typically between 50 to 200 micrograms a day, sometimes up to 360, especially if you're already supplementing with high doses of vitamin D. Now, here's the key part. These two vitamins work best together. Vitamin D boosts calcium absorption. Vitamin K2 makes sure that calcium gets where it needs to go, your bones, and stays out of where it doesn't belong, your blood vessels. Without K2, you can end up with too much calcium in the wrong places. That's why combining them is safer, because they're both fat soluble. Always take them with food. And for even more benefits, add magnesium. But we'll talk more about that in our next video. So, who should be paying attention to this? People with osteoporosis, heart disease, diabetes, or other chronic conditions, anyone with low sun exposure or a poor diet. Doctors sometimes prescribe up to 50,000 IUs of vitamin D3 for deficiencies. And studies show that even long-term use of high doses is safe and effective. In fact, research shows that vitamin D supplementation may help with conditions like asthma, psoriasis, rheumatoid arthritis, rickets, and even tuberculosis. At RegMed Georgia, our American Center of Regenerative Medicine in Tbilisi, Georgia, we offer personalized recommendations for supplements. This helps regenerative therapy and speeds up recovery. We've linked a few scientific articles in the caption if you want to dig deeper.
Tribe of Noise Music.